Dr. Victoria Villaflor, MD, Professor and Director of the Head and Neck Oncology Program at UCI Health, shares critical insights on head and neck cancer treatment in our exclusive interview. Notable quotes from this interview. Cemiplimab was a practice-changing trial. For cutaneous squamous cell carcinoma with high-risk features, I'd be inclined to give adjuvant cemiplimab after surgery and radiation. Somebody with a rapidly growing tumor or high risk of airway loss might be better for the nivolumab post-op regimen. Surgery, then nivolumab with chemo and radiation. The new EGFR-directed ADC, Becotatug vedotin, gives us more tools to help patients with advanced nasopharyngeal cancer live longer after initial treatments fail. How do tumor characteristics help decide between using pembrolizumab before or nivolumab after surgery for head and neck cancer?
It's difficult to say exactly why, what patients should be going to the trial as in, or the treatment as in the trial, the Keynote 689, versus patients undergoing the NIVOPOSTOP treatment regimen. Most of the time, it's imperative that we have a multidisciplinary team working together to make these determinations. So, as we all know, a lot of these immune therapies take some time to work. Hence, somebody who has a very rapidly growing tumor or is at a high risk of having loss of airway or perhaps a sentinel bleeding event might be better for treatment according to the NIVOPOSTOP trial regimen, and that would be where they undergo surgery, then undergo nivolumab with chemo and radiation. However, somebody who may have like a tumor that is not as rapidly growing or is not in dire straits in having some kind of sentinel event happen, may be better in undergoing treatment as per the Keynote 689 regimen, where they get neoadjuvant treatment because there's some indication the development of distant metastasis may be a little bit lower when given with the neoadjuvant treatment.
Why did cemiplimab work better than pembrolizumab in preventing skin cancer from returning after surgery?
That's a great question. I think that it was possibly the trial design. It may also be in the way that these checkpoint inhibitors bind to certain parts of the antigen, either on the tumor or the T cells. It's very difficult to say. That being said, with cemiplimab, that was a very positive trial and is practice changing. Hence, if a patient with cutaneous squamous cell carcinoma and high-risk features undergoes standard of care surgery followed by radiation, I would be very inclined to give them adjuvant cemiplimab as well. The Keynote study with pembrolizumab was not a positive trial. There appeared to be some benefit, but I think some of that may actually be due to the way the trial was designed, maybe the lag between the completion of their radiation and the start of the actual pembrolizumab may play a role. It's hard to say.
For advanced nasopharyngeal cancer, how can the new drug Becotatug vedotin help after other treatments fail? And what challenges might it face?
In patients with advanced recurrent metastatic nasopharyngeal cancer, there have been recent data in the Jupiter-2 trial which actually shows an advantage of treatment with a cisplatin gemcitabine toripalimab regimen. However, after that, it's pretty much the wild, wild west in that we have multiple chemos that we know have activity, but these patients do not do well following the initial treatment. Hence, having some of these drugs, like this new EGFR-directed antibody ADC, actually gives us more tools in making these patients live longer. Most patients with recurrent metastatic nasopharynx cancer tend to be very healthy patients who get these cancers, and they tend to be younger. So we do want to be able to have them living longer with better quality of life if it's feasible. And to date, we have nothing other than this new EGFR-directed ADC. So I think it's important that this does get further developed. It's very impressive that it was almost able to double the progression-free survival from that of single-agent chemotherapy, which we're currently using in this very small trial.